The bariatric program is focused on people who are overweight and excessively overweight, not just a little bit overweight, but a lot overweight. And so these are people that have had trouble with their weight probably for a long time, have had numerous attempts to try and lose weight in various forms, and still struggle with their weight. And also focuses on people that have medical complications from their obesity, and that can range from things like diabetes, which is a metabolic disorder, to wear and tear, like effect on the joints, like knees and hips.
This bariatric program provides assessment and post-op care for patients seeking bariatric therapy, so gastric bypass surgery. Well, we work closely with the family health teams that are in the area, so we have done a lot of in-servicing to the family physicians and different family health teams. Also the pharmacies in the area as well are some of the stakeholders that we utilize. I think there are a lot of stigmas out there, and it's very interesting. My background's always been a lot of diabetes, but now seeing patients that are coming into the clinic and just speaking with them about some of their lifestyle and some of the things that they've had to live through. There is a big stigma associated with obesity, and I think too sometimes it's not always about eating unhealthy or eating too much. Sometimes there are other things that can cause obesity, and there's definitely a genetic, hereditary link there as well. So.
Well, obesity is a big part of our chronic health conditions in our society, because obesity comes with those other health conditions like diabetes and high blood pressure and high cholesterol and arthritis. And it is a chronic condition by itself, obesity, because of the other problems that go along with it. So it's part of our changing society. And as people get older, if they've been overweight, heavy since the time they were in their 20s, that carries with them that chronic illness well into whatever decade they live to. Obesity as a predominant part of our society has only been for the last few decades. It still has a black label attached to it. People are often face prejudice because of their weight and their size, just because visually they stand out. It's a visible minority, and so they suffer from that discrimination. They also suffer from the fact that they are overweight, and so it does limit their accessibility. They may have trouble moving around, walking stairs, getting through doors even, getting into vehicles. So it does limit their mobility, and of course the larger the person is, the greater that effect is. But for people that want to manage their weight and do something about the weight, particularly if it's causing them problems, that's requires a whole lot of changes. And the changes involve everything from their own behaviors, how they eat, what they eat, how they exercise, how they don't exercise, how they work, what sort of work they do, to society as well, and how we manage foods that are available, healthy foods versus not so healthy foods, and how readily they're freely available, how we market things and put things on shelves that are appropriate or inappropriate for some people.